Hi, good afternoon from Austin, Texas. We're pleased to be here with Dr. Terry Kim. Terry, welcome and good afternoon.
Thank you. Thanks for having me, John, as always.
Terry, it's been a great meeting, and we've talked a lot at this meeting, and we've heard a lot at this meeting about innovations in cataract surgery. And I'm wondering if you can shed some light on some of the more recent innovations that we've seen as far as improving phacoemulsification and some other exciting technologies that have come forth.
Yeah, sure. John, today at the Industry Spotlight, I did talk about some of the advances that are available through Alcon's phacoemulsification system, one of which is called the Active Sentry, and the difference here is in the handpiece. Instead of the irrigation pressure sensor being in the actual console of the Centurion unit, it's now located in the actual handpiece. So you're going to get a much more robust and active feedback in terms of sensing the pressure with irrigation and aspiration, which is going to basically what's going to boil down to is it's going to improve the post-occlusion surge that you get. And even though with the latest data in Centurion, it's pretty good, it's going to make it even better. And secondly, I think it's going to improve responsiveness in terms of the fluidics that you get during the case. And then thirdly, you're going to be able to really maintain that target IOP throughout the case because you're going to have that active feedback right where you want it, which is obviously closer to the eye where all the action is going on.
Yeah, that's a great point, Terry, because rather than it being back away from you and back away from the field, it's now right in the field, right in the eye, and it's going to give you that more instantaneous or quicker feedback than it already is. So that's a great innovation. What are some of the other innovations that you?
So regarding the phaco part of it, the Transformer IA handpiece has been out for a little while, but for folks who haven't tried it, I highly encourage it. It's a disposable IA handpiece that basically allows you to switch between a coaxial and a bimanual approach. So we certainly know some of the advantages of doing bimanual IA. If you're trying to get cortex in a difficult to reach quadrant, which is typically located subincisionally, it's a great way to access that cortex. I particularly find it helpful in my femto cases because when I'm using the femto for cataract surgery, the femto cuts the cortex. So in a manual case, you have these finger-like leaflets that extend past the edge of the capsulotomy that you can grab easily with the IA tip. But here they're cut, so it's really helpful to go in with a bimanual approach and access that subincisional cortex so you know you get it out. It also actually helps if you end up having, you'll be eyeing and all of a sudden you see a little nuclear chip come in so you can crush the tip, with the other part of it to get the nuclear piece out without having to switch to a phaco handpiece. And then there's another tip that I have not tried yet, but it sounds very interesting, which is the Intrepid Hybrid tip. And that's actually going to be a disposable polymer tip that allows you not only, it's going to be smooth and polished so you can do your IA and even polish the capsule, but it also is going to have cutting capability so you don't necessarily have to switch between your phaco and your IA handpiece, which I think will improve efficiency.
Oh yeah, that sounds like a great innovation. I wonder also if we can speak for a moment about IOL innovation. I know we've come quite a ways, especially in terms of presbyopia correction, and then there's some novel presbyopia correction that's potentially coming down the pipeline. Tell us a little bit about that.
Sure. I mean, I think everyone's excited about hearing the arrival and introduction of Alcon's trifocal IOL technology, which is going to be called PanOptix. I have not had a chance to use it yet, but I was encouraged when I was at ASCRS and also in some of my trips to some of the Asian meetings, listening to users and their experience and looking at the results with that technology seem encouraging. You've probably seen some of the defocus curves with some of the traditional multifocal lenses where you have that little gap in vision that results in patients having kind of, distance vision and near vision, but perhaps no intermediate. So I think based on this trifocal technology, you'll see less of those gaps, and patients will have a broader range of vision where they don't lose vision, which I think will be appealing to the patient. Of course, we'll have to still weigh, what the pros are in terms of using this technique to minimize some of the side effects that you can get with some of these multifocal IOLs. But I'm excited about the new technology that's coming about.
Yeah, that sounds great, Terry. And all of these innovations have really helped us as surgeons to provide better surgery and safer surgery for our patients. And at the end of the day, that's always going to be a win for everyone.
Yeah, and the last technology I just want to touch on, John, is because there are reports that 40 to 60% of ophthalmologists actually stop practice prematurely because of neck, cervical spine problems. Operating has a lot to do with that in terms of the position that you are. So Genuity is another advance that's out there that Alcon's heading. And this is the heads-up display on a big screen where you wear the 3D glasses and then eliminate the need for oculars on a microscope, because that's where a lot of the neck strain comes from. And I think the technology's come a long way since the first time I evaluated it. The resolution's incredible. Your image resolution is also incredible. No lag time. So I think this is going to be a great way to incorporate some of the diagnostics that you're getting intraoperatively, also better in the teaching environment, which is where I'm at, having residents and fellows seeing what you're doing. So I think that's going to also ultimately help us long term in avoiding some of the health issues that we see from a lot of surgeons who are in that position, straining their neck with an ocular and a microscope, traditional microscope.
Right on, Terry. Yeah, a super important point that as ophthalmologists, we have to not only make sure we're caring properly for our patients, but that we're caring for ourselves so that we can continue to care for patients in the long term.
Absolutely.
Thanks so much for sharing your expertise with us today on these exciting innovations. It's always great to have you here.
Thank you, John.